Hi YouTube, welcome back to our channel. This week I am going to be talking about dry eye disease. I'll be going through the definition, some of the symptoms that you may be experiencing if you have dry eye, and then also some risk factors, and then also some behavioral changes you can implement to help improve your symptoms. So the definition of dry eye, there's an official one. It is saying dry eye is a multifactorial disease of the ocular surface. It's characterized by the loss of the homeostasis of the tear film and accompanied by ocular symptoms in which tear film instability, hyperosmolarity, ocular surface inflammation and damage, and neurosensory abnormalities play etiological roles. So there's a lot of things in this. But basically it's saying it's definitely not one cause or one influence that's causing you to have this. There's definitely a lot of different factors that go into it. There's a lot of different symptoms that you may be feeling. There's a lot of people that go through this, so don't feel like you're alone. But some of the symptoms that you may be having, burning sensation, could be synonymous with stinging. There may be feeling like you have something in your eye. Chronic redness can also occur. Kind of counter it. Something that's weird about dryness is that you may have watering of the eyes because the body overcompensates and then you end up producing more tears. If you ever say that your eyes are feeling sore or they're tired, that could also be. And then fluctuations in your clarity throughout the day is also something that could happen. So some of the risk factors for dryness, it could just be with age. We have glands on our eyelids that get damaged or lost over time, so increasing age also affects dry eyes. If you're female, you do have there's a higher prevalence of dryness with older females. If you wear contact lenses, you have an increased risk of developing dry eye by around 2 times. And then if you're on devices a lot, like the computer, your phone, any tablets, you end up blinking less unconsciously, and then there's a higher rate of incomplete blinks. If you live in an environment where the air is cold or really dry, or it has a lot of air pollution, that could also affect you. And then any type of refractive surgery, so like LASIK, it could reduce the amount of tear secretion, and then it can also cause tear dysfunction. Some medications that can also affect dryness are any type of allergy medications, antidepressants. There are some for anxiety that also affect dry eyes, and then anything such as like Accutane that affects your glands that produce oil that could also affect dry eyes. So some things that you can start implementing even before you go see your eye doctor: increase your water intake. If you're dehydrated, your body's not going to have enough water to produce your tears. Control caffeine. I know coffee, everybody loves coffee, tea, stuff like that. That can also affect your dry eyes, so try controlling that. And then just with environmental factors, so like if you have to sleep with the AC or the fan circulating, try to position it so you're not right in front of the vent. And then if you're working on the computer a lot, position yourself so then the fan isn't blowing directly at your face. When you're on the computer a lot, I would recommend definitely taking a lot of breaks. When you're taking your break, don't use it as a time to look at your phone because that kind of defeats the purpose. Look somewhere far away, blink for a couple times, and also just remember that you want to do complete blinks. If it's incomplete blinks, then you're not really distributing the tears over your eye. Then other things are, especially with COVID now, since everybody's on the computer a lot, the way that you want to position your computer is either straight in front of your eye level or a little bit below. If you end up having it a little bit higher, then your eyes are open wider, and then you have more space for your tears to evaporate. So this is things that you can start changing now, even before you come in to see your local optometrist. And then next time, whenever you come in, next month, we'll be talking about the different subsets of dry eye and then some of the treatment options that we can implement even after this if you feel like your symptoms are still the same or they're getting worse. All right, thanks.